Good morning. This is Dr. Brad cutting in again. This is the third and final session of this just deeply raw personal conversation with Dr. Deb on the issues that women have, trying to find answers to their very vulnerable personal struggles that typically are met with this condescending, demeaning attitude from their caregivers that really destroy their self-worth. So we get a little bit more clinical on this last one, but we keep the same open, raw conversational language through the whole thing. So here we go. We're jumping in here.
He was convinced it was MS. So it was flashback all over again. And did an MRI. MRI came back with white matter brain disease. So I got tagged as an MS patient. And I remember the day I got the call, it was 3 days before Christmas. And he said, "You got MS." And I said, "Thank you, but no thank you." I said, "In my world, MS is toxins and infections and all kinds of things until proven otherwise." And he begged me to go get biologics and all these crazy things that we do. And I said, I appreciate your help, but I'm not going to do that. And, and I went down the rabbit hole that I take every one of my MS patients and all my neurological people and identifying all of the things that could potentially be wrong. And of course, I hit the trifecta. So I had toxic mold and multiple tick-borne diseases and toxic chemicals and all these crazy things that I've accumulated in my life over the years, whether it was physically or by osmosis from my patients, as Dr. Klinghardt will say. And I decided to take myself on that same journey. And 18 months later, my white matter brain disease was reversed, which is unheard of. We don't reverse white matter brain disease in this country. And
Which I'm gonna stop you right there, because in what we talked about earlier, the treatment of MS is to use some kind of a pharmaceutical to try and stop the biochemical reaction that they believe is at play there, correct?
The immune system attacking the brain. And so the drugs they use help to stop that progression.
And generally they can't stop it, they can slow it.
Correct.
But they can't stop it. And the only way to really stop it is a lifestyle issues of identifying the cause.
Correct. Identify the cause that's creating the problem, eliminate the cause, and the problem can stop. And I went one step further than that because I said, I'm not going to just say, okay, now I have this white matter in my brain, which is scar tissue. It's never going to go away. I said, I'm not going to do that. So I learned from Dr. Goodenow, who's a PhD on his patents are in Alzheimer's, and he's regrowing gray matter and reducing white matter in the brain. And I said, teach me what you know. I want to be part of your group. And it was about 8 months after I started his protocol that I was able to increase the gray matter of my brain by 2 standard deviations. And we completely stopped the white matter and started reversing the white matter in the brain. And so when we tell people that these things can't be done, they can be done. We just have to understand what's causing it in the first place and eliminate that problem and then give the brain what it needs to grow.
Which is really an interesting thing, because you did something a lot of people don't understand in all of, whether you're talking public or healthcare issues, is first of all, you reject the diagnosis.
Yep.
You're not treating a diagnosis. You are looking for causation.
Mm-hmm.
Totally different realm.
Totally different. Totally different. I was not letting that MS into any part of my being, not into my soul, not into the cells, nothing. I was not accepting that diagnosis because I knew once I accepted that, it would become part of me, whether I wanted it to or not. And from the spiritual realm, I was like, I'm not owning that. That is just a label, and it's not going to be my label.
Interesting thing about from the spiritual realm you just said. I want to share this experience I had down in Mexico. I've done a lot of ministry down there. We got got a call to go out to somebody's house to do a deliverance. The young man had basically tried to strangle his young wife, and this second or third time.
Okay.
Something like that. And we show up, there's at least 3 different ministers there, somebody that knew me from the States pretty well, me and this guy. He starts like manifesting, and it's like his nails are growing, and he's changing his distortion, and his voice is changing. He's growling, and he's doing this. And the interpreter asked me, "You have any idea what he's saying?" I said, "No, I have no idea." He goes, you don't have enough faith to deal with me."
Oh.
And I busted a gut laughing. I was like 3 feet away from this guy. It was weird. I'm laughing so hard my belly hurt. As I'm laughing, all of this manifestation starts to diffuse. And he didn't want to deal with the issue. People don't like this term, but it really states what was going on. He was a bastard son. The man who he thought was his father was not. His father hated him. His mom was either pregnant or already had him before they got together. He wasn't his own child, so he was treated as dirt. And all that angst, all that anger is coming back. When you focus on that, you empower those things. In him, it was a demon doing all of that manifestation. When you don't focus on it, it deflates like this guy did. And it was amazing to watch that whole process. He didn't want to deal with those issues. And the arrogant minister that we love, he thought he did something with this guy, and he didn't. They just kind of twisted his arm and forced him in it. But you said something that is such a huge foundational spiritual principle. You don't empower those things by concentrating on them, which is one lifestyle issues. You don't focus on what you can do. You highlight what you can. And you empower yourself to go forward. I wanted to stop you right there just because that principle is so crucial in regaining health. Spiritual health for sure, but mental, physical, the whole 9 yards.
Yeah, I mean, and I went down a spiritual path as well and said, okay, some of this is coming from this lifetime for me. I get that some of this is probably coming generations back from the women that came before me, what they kind of kept bringing on generationally. And I went down that path as well and said, okay, I want to let go of what's not mine.
I wasn't sure what you
Whatever
were
they
doing
own
either.
is what
Sorry,
they
I heard
owned,
you say
but I'm
something
going to not bring it forward anymore and let it continue to be an issue. And so I dealt with those generational things that, we don't necessarily see or feel or hear or cognizant of. But I went back and I cleaned it up and I said, I'm going to stop it here. And I actually had my daughter come into some of it with me, and I said, you need to stop it, because if it's here, it's there. And if it's with you, it's with your daughter. And we need to make sure that we don't continue this legacy on and on and on. So let's transition the whole thing right now and stop.
Interesting. And something else with the Scandinavian cultures, it's like the North Woods up there. When I got into Siberia a couple years after the Berlin Wall, and the first time I got into Eastern Europe and Russia was as the Berlin Wall was come down, way back 2 years later. And again, a couple years later, 5-day trip on Trans-Siberian Railway. The climate up there is the same as what it is in the North Woods, in Wisconsin, Minnesota, just those 2 states, nowhere else. And the diet of those cultures is not something that will feed the brain and make it healthy. So you're talking this whole life change of that. What is that dried fish that they have in the
Lutefisk.
Yeah. Is that something that you eat?
I don't. My grandparents did, but I don't eat it.
Now, when you think about all the healthy oils in the fish, they
Mhm.
packed them, they fermented and salted them, and you don't have to get in the background of all that. And they
Mhm.
always celebrate that around the holiday time
Yes.
with the
Mhm.
cream sauce and all that
Yeah.
hyperinflammatory, no good healthy oils for brain health,
Right.
and all of those things that go on. And you have this cultural clash
Mhm.
with a wake up call like that of I've got to lay a lot of things down of this culture
Yep.
and change these foundations because that's what brought me here.
That's exactly right. Exactly right. And it's a big lifestyle change. And, for me, it was. For my clients, it is as well. And it can be a little overwhelming, but once you learn it, you realize it's not as difficult as you think it is. And you can
Yeah.
make healthier versions of your family traditions. I've learned how to do that. And so you don't have to give everything up. You just make healthier versions of them.
Yeah, and the thing that I always bring up with people, you're not taking things away. You
Right.
need to learn to substitute
Hmm.
what's bad for what's good.
Yep.
So that's a big concept. And good for you because you're a leader in your own generations of family.
Hmm.
Bringing your daughter into that, that's a lot of wisdom,
Yeah.
a lot. And in your practice, you get to carry women forward because these things are more common in women than men, right?
Very much so. Yes. Hmm.
It's like 2 to 1, isn't
Two to
it?
one. Yep. Hmm.
So have you dug into why that is more common in women than men?
I have. Some of it's genetic, but a lot of it is emotional. It's the emotional traumas that we have. If we look at the emotional traumas that women live with, it makes them much more susceptible to the neurological conditions. Even if we look at like traumatic brain injury affects women differently than it does men, but yet traumatic brain injury is one of the number one things that can cause neurological conditions in women like MS, Alzheimer's, and dementia, and things like that. And we don't recognize the traumatic brain injuries that women have. They're much more discounted than for men.
Yes, schizophrenia is extremely common in Nordic women. Extremely.
That's interesting.
Yeah, think is a coping mechanism for the extremely long, insane winters.
Hmm.
I mean, up there in the North Woods, it's 6 months of winter, a few weeks of spring, a few weeks of fall,
Yeah.
and mosquito season.
Yeah. And like 3.5, 4 months of no sun, which is not good for any of us.
No, no, it's it's absolutely amazing. The I think it's interesting that you're talking about it's the emotional trauma because you're in this stoic vacuum
Hmm.
of emotional expression.
Yep.
I don't know if there's any two states with a higher Scandinavian population than Wisconsin and
Yeah.
Minnesota.
I'm not familiar. I think we are the two high.
Oh, and it's basically because the terrain is almost identical.
Hmm.
Climate's almost identical.
Yeah.
And they got to have their mosquito season over there.
Gotta have it. Can't live without that, right?
Yeah. And these diets, it happened because of war issues of these things are completely devoid of fats for brain health. And it's
Yep.
no wonder why that happens. And you look at the baby factory issues of women not understanding how to replenish their stores, which that's why she gets more osteoporotic issues, which I think is interesting. Do you know that the only cultures that get osteoporosis are the dairy consuming cultures? Were
I
you
didn't
aware of that?
know that. No, I didn't know that.
Bunch of reasons why.
Yeah, dairy is so inflammatory and has no calcium value to it anyway, at least the way it's processed here. So, yeah.
Yeah, there's all kinds of physiological things. It's
Mhm.
really not time to do that. But Scandinavian cultures are really big into cheeses, aren't they?
Yes, we are. Mhm.
So, and with that, you have this huge hyperinflammatory hormone
Mhm.
hit. And with cheese, it's super concentrated.
Yep.
The whole cheese industry is fed off of corn, which is sprayed with atrazine, 10 times worse than Roundup.
Yep.
And Roundup, and you concentrate that in things like cheese,
Mm-hmm.
and you have all these herbicides that are atrazine and makes males in the whole animal kingdom not express maleness. They can't produce testosterone.
No.
Disrupts women's hormones. So
Mm-hmm.
that's all concentrated inside of the diet without anything to replace any of it. And it's a no wonder that all these things show up.
Yeah.
So,
Yeah. We don't, it's those kinds of things that we don't think about. Like just doing the lineage of how dairy is affected, right? And we think dairy is so great in so many ways. And even if we make it pure or organic or raw, it's all fine. But it's still not. And I don't think people think far enough down the line of what we do to the animals that produce the dairy in the first place.
oh, that's insane. You look at the white cell count in milk, it's at the level of acute infection in the blood.
Hmm.
It's 300,000. It's unthinkable. In reality, you're drinking pus,
Yeah.
not milk.
I tell patients that all the time. You drink pus, you don't drink milk. And they're like, what? And they're like, yeah, that's what you're drinking. It's an eye opener when we have that conversation for sure.
Yeah, I remember when I moved into dairy country, it was pretty common to have cows in their late teens and into their 20s
Hmm.
on the milking line.
Yeah.
There's not a cow on a milking line that's over 3 years old. Most of them only make it to two.
Yeah.
They're pushed that hard.
Hmm.
Uh, and it's really an inhuman thing. They're a commodity. They're
Hmm.
not cared for. It's just they produce these hyperinflammatory hormones
Hmm.
that toxins embed in fat. There is high fat content. You have this toxic storm, and we just talked about two things: dried fish and dairy.
Yep. Exactly.
Big perpetrators
Yep.
of the big nightmares that are out there.
Yeah. Yeah. And I was a big cheese eater. I loved my cheese, and how I rarely ever have it.
Yeah, Wisconsin is one of the places with the most gourmet cheeses. You have all these small, um, mom and pop places
Yeah.
that don't dye their cheese and they make these specialty cheeses. It's probably some of the best cheese you can get in the U.S.
Absolutely. And the aged cheddars and things like that are, gosh, they're just so good. But yeah, they're just not good for us. And, so you limit them and don't have them as much as you should and enjoy them when you do have them.
Yeah, no, these are some of those cultural confrontational realities that
Yeah.
you have to deal with
Hmm.
to stop the insanity. If you approach this as if it was a diagnostic thing, you wouldn't have been able to restore and rebuild your brain.
No, I would not have. I would have been stuck on some immune suppressing drug that costs, what, 150,000 probably a shot or a year. And I wouldn't have restored anything. And I would have just continued to decline in health. And I know that.
Yeah, it may have slowed that decline down, but you wouldn't know that
Right.
because the causation is never discovered,
Right.
addressed, and removed. That hopefully the listeners can understand the beauty of the simplicity of what the real solutions are with, with what you're talking about. These are some of the scariest nightmares out there is these degenerative autoimmune responses that lead to dementia.
Yeah. Or ALS, you know.
And they're all the result of poor lifestyle choices.
Hmm. Yeah. And if you can stop the damage fast enough and reverse the damage, fast enough, you can have a really amazing life. It's when we wait too long to make these changes that we have a really hard time fixing that problem then.
Hmm. Yeah, well said. Oh, we should wind this down. Any closing words of wisdom you'd like to leave with our listeners?
I would say this, um, trust your gut, trust your instincts. You know when something's not right, and we always question it and wonder what I should do with it. But if you truly lean into it and listen, all of your answers are there. And then you just need to find the partner that you connect with that can help you along the path and get you one step further than where you are right now.
I'm gonna clarify something. The partner you're talking about is a clinician, right?
Correct. Correct.
Right, right. And I think that's a really big thing. When you have these sensitive issues, you need sensitive clinicians
Yes.
that you can sit down eye level and connect with. If you can't connect, you should probably run.
Exactly. Exactly. When you walk into a clinician's office and the hair on the back of your neck stands up, that's not the place that you want to be. That's not the right place for you. It may be the right person for someone else, but it's not the right person for you.
Yeah, yeah. Well, it's interesting what you have to build in different things. The evangelist comes into an area, they stir up faith so they can release gifts.
Hmm.
If you do deliverance or healing, you have to build trust.
Yeah.
And you cannot build trust if you're not transparent and vulnerable.
Hmm.
That's a place that most clinicians are terrified to go
They are.
because their egos are so fragile. They're not built on eternal lasting things.
As a clinician, I really feel like I'm just the partner, right? I'm just the person that has a little bit more information and knows how to put the pieces of the puzzle together differently than the person that's sitting on the other side of the table from me. But we do it as a partnership. We don't do it as a top down. Um, I can give you all kinds of suggestions. It doesn't matter if none of them resonate with you and if you're not comfortable doing any of them. But I can't give you the good suggestions if you're not 100% honest with me either. So it's got to be, we both have to give and we both have to be willing to say, you know what, I might not have all the answers today. That doesn't mean that I'm not going to find them for you or keep working with you until we both find them.
Yeah, I think Hippocrates stated it this way. Ask the person what comes to you that wants help if they're willing to give up the things that destroy their health before you offer to work with them. And that is one of the things as a clinician that we have to really be careful with
Hmm.
because to be good, you have to, the amount of soul energy it takes to help people through is so draining.
It is very draining.
Because you're literally carrying them in a spiritual sense
Hmm.
until they can get on their own feet.
Yeah.
Um, there's a lot of times in life where it's the faith of others that carry us, it's not our own.
Mhm.
And in the kind of work that we're talking about, that is one of the characteristics of a good clinician.
Mhm.
Um, People don't understand the reality of faith very, very commonly because it's just not taught right.
Yeah.
But that is a critical place for those who have been vulnerable, felt abused, just ignored in the system. The difference in bringing that dimension in where you work with clinicians and will actually help carry you through
Mhm.
is so refreshing,
Yeah.
but it's so draining.
It's very draining. It's very, very draining some days. And some days it's really exhilarating too. I mean, there are days
Yeah,
that we get filled up just as much from our clients as we get to fill them up. And that's a good thing. But that's usually not until they're starting to feel better on the other side.
right. And those when you get the wins.
Yeah, exactly.
Um, those are when you get the wins.
Hmm.
So it's been awesome. So thanks for coming. I'm going to close this one off.
Thank you. It's been a pleasure.
I want to thank you all for joining us for these 3 sessions. This one with Dr. Deb has just been really, really, really special. And I'd call up support to even recover her voice because it wasn't showing up. And I figured out how to do it on my own, which I'm really grateful for because I didn't want to have to redo this one because this conversation is just so raw and personal and to the heart of so much of what goes on with women. So we've covered the condescending issues, we've covered a whole bunch of clinical issues, we've covered a whole bunch of issues on what it really takes to heal, get somebody so that they'll do better, so they can regain their health and life. And she's got a very unique perspective, being both a naturopath and a doctor. So two doctors talking together, they're both more empathetic and more sensitive to these issues. And this has just been one of the best conversations I remember having in a long time. So I hope you really enjoyed this. Tune in with us next time. Put a review on there. Share this with your friends because it's really, really rare to find conversations like this. This one has just been one of those absolute total gems. So thanks. Have an awesome day. Bye.